because ligaments don't have a great blood supply. And if there's no external force or stress triggering them to heal, then they often just stay loose.
Just out of curiosity, is there physical therapy or another means other than injections that, if cervical instability is to be found off of the digital motion x-ray and it's causing, vagus nerve disruption and all that other stuff, is physical therapy an option to, reduce these symptoms over time to an end-all cure, or is this something more your best bet is the PRP route with a series of injections over time, or is it, obviously it's case dependent?
Yeah, so good question. So here's what I'll say is physical therapy is going to be phenomenal as long as you have the right people and the right type of therapy, can be really great at helping to restore the curve. That usually will require some adjustments as well and things like that, but curve restoration, and then also strengthening the muscles to pick up the slack that the ligaments are not doing. And so some patients can see significant long-term benefits with doing curve correction and physical therapy, but a lot of patients still require treatments of the ligaments because most of the time those ligaments are not going to strengthen back on their own because ligaments don't have a great blood supply. And if there's no external force or stress triggering them to heal, then they often just stay loose. It's like somebody who rolls their ankle a ton of times playing high school basketball. They're probably gonna have a loosey-goosey ankle for the rest of their life. Though even with physical therapy, you can make that better by strengthening the muscles around the joint to pick up the slack. But that ligament never really gets stronger just because ligaments are harder to heal on their own, especially when they're chronic. Now, nothing's outside the realm of possibilities. I like to try to not speak in absolutes because if people can be cured of cancer and without actually going through, any form of treatment, I believe that ligament can heal on its own. It just may not happen very often. You know what I mean?
Right. Yeah, exactly.
And so that's why we're almost always pairing the injections with the physical therapy with chiropractic care because it's just going to expedite the treatments.